All right, everyone, we're waiting a little bit longer for our YouTube live stream to get set up and for folks to trickle in. I see the numbers going up right now. So we'll just wait a few more seconds here to let folks get on and get the YouTube all set up. Okay, I'm going to get started here. YouTube is live. We've hit a kind of stagnant point for participants. So I want to start off the evening thanking everyone for joining tonight. This is hosted by the Wisconsin Environmental Health Network, which is a group of health professionals and health advocates that are advocating for a cleaner, safer world for all. We do this through advocacy, through training, by providing the health voice to many of these topics. So that is WEHN. And my name is Hannah Mortensen, and I'm the executive director. So I do want to give a quick shout out to all our steering committee that have been amazing throughout this whole process. This is our last lecture of the series, so thank you to all of them for helping making this happen. I'm now going to turn it over to Marina, who's going to go over some housekeeping rules for tonight.
Hello, everyone. Thank you so much for joining us again for the final night in our Health and Environment series. Quick note, throughout the presentation, only the panelists will be have their video on and can have their mics on as well. Everyone else will be, videos will be off. And then if you want to submit a question during any time during the presentation, you can submit it during the Q&A box at the bottom of your Zoom screen. Or if you're joining us through YouTube, you can also send an email to wenmail@gmail.com. You can find that email on our website as well. And we definitely welcome your questions, and we'll do our best to answer all of them at the end of the presentation. In addition, if you want to change your view while watching the presentation, in the upper right corner is you can adjust it to be speaker or gallery view for the panelist, or at the top there are view options where you can adjust the ratio of the presentation. I will now hand this over to Anne, who will introduce herself and our speaker tonight.
Hi, everybody. My name is Ann Behrman. I think I know a fair number of you since I've been in Madison for about 40 years. I worked at Group Health for about 30 of those years as a general pediatrician, and got involved with the Wisconsin Environmental Health Network from my long-term steering committee time with Physicians for Social Responsibility, first in Madison and then for all of Wisconsin, and got involved in environmental work thanks to Laura Ola and Citizens for Safe Water around Badger, because I had patients who came to me with headaches and a sheet from the Badger Army ammo plant saying their drinking well water was contaminated with volatile organics, mostly carbon tetrachloride and chloroform. And that kind of charged me into looking more at and learning more about environmental pollutants in our air, water, and soil. It is my great pleasure to welcome again Leo Trasande, who was one of our first Wisconsin environmental health speakers on methyl mercury back in April of 2005. He actually was a speaker for the university at their Earth Day celebration on the 22nd. We also took him to the Progressive. We took him to speak to Sierra Club about methyl mercury. He was at a rally on Bascom Hill to get rid of the Charter Street coal plant. And he ended up going to the Dells to speak, I think, to the state medical society about environmental health. So we've had a long relationship. I haven't seen each other in a while, but at pediatric conferences, I've heard him speak. And at the time when he was here, I think he was at Mount Sinai. At present, though, he is the Jim G. Hendrick Professor at the NYU School of Medicine and the Director of the Division of Environmental Pediatrics and Vice Chair for Research in the Department of Pediatrics. He also teaches environmental health policy at the NYU Wagner School of Public Service and the NYU College of Global Public Health. His research has been on many things. He has and continues, I think, to research the neurodevelopmental, cardiometabolic, and respiratory profiles of children exposed in utero to the World Trade Center. I think they started looking not only at pregnant women and babies who were born soon after, but also at adolescents who were exposed to all the pollutants that came from the World Trade Center disaster. He's looked at lead poisoning and its cost around the world. He was part initially of the National Children's Study, which Madison was part, actually Waukesha was one of the centers. And Maureen Durkin, who's the chair now of Pop Health, was one of the researchers along with Leo for the National Children's Study. But now he is part of 35 centers around the country as part of the National Institutes of Health Environmental Influences on Child Health Outcomes, or ECHO project. And I encourage you to look into ECHO and find out more about it. And actually 2 sites in Wisconsin, here at the UW with Jim Gurn and the Marshfield Clinic, are also part of that study. But probably Leo's best known at, and now for a series of studies that were published in both Lancet Diabetes and Endocrinology and the Journal of Clinical Endocrinology and Metabolism that document disease costs due to endocrine disrupting chemicals in the US and Europe. Now that the price tag in the US is around $340 billion, or about 2.3% of our GDP. I think that's annually. And he also in 2019 wrote a book for both health professionals and the lay public called Sicker, Fatter, Poorer. And I recommend it. I read the introduction just before this evening, and I wanted to read you one of his quotes. Leo says in the book, currently my research focuses on identifying preventable and environmental factors that contribute to obesity and other chronic conditions in children, as well as measuring and documenting the economic costs of failing to prevent environmental hazards. So, this is kind of I think a hopeful way to end this series, to say there is something that we can do with policy in our country to prevent some of the things that we're seeing that are causing problems with kids neurodevelopmentally and endocrinologically, et cetera, et cetera. And I hand it over to Leo to hear all the things that he has to say about this. Thanks so much, Leo, for coming back.
And thanks so much for having me. It brings me warm memories to see you, and especially to hear you talk about the time in Madison and the Dells and zipping and zapping all across Wisconsin. And I hope to be doing that with you all in person soon. The pandemic has made things a little more complicated in terms of communication, but it keeps the spirit strong. And unfortunately, it's brought into sharp relief the reality and urgency of addressing environmental contaminants. I won't get into it as much in this presentation, but if you put SARS-CoV-2 together with other viruses that are increasing, we appreciate more and more that those increasing pandemics, and there are more to come probably, unfortunately, arise out of climate change and a host of environmental factors that have brought viruses and other microbes into closer contact with the human species. And in addition, that's in the context of synthetic chemicals literally hacking our immune system and thereby contributing to disease and disability. Well, this talk isn't about the immune system per se. There's rapidly rising evidence to support that. So maybe at a future date, we can talk about what we learn about the role of environmental factors in immune disruption. But for today, we're going to talk about another system that really has brought into sharp relief the urgent threat of environmental contaminants on people's lives. And there's a lot of commonality with climate change, because if we think about the primary sources of some of the chemicals that I'll talk about tonight, they're really to a significant amount rising out of fossil fuel production and consumption. And ultimately, we have an opportunity by addressing climate change to have substantial co-benefits in the form of preventing many of the toxic chemical exposures that I'll address tonight. So without further ado, it's a pretty broad-based talk. I'm going to start with some common terminology and points of reference for folks, not assuming that folks know everything. First, just a disclosure, as Anne said at the top, I have written a book, and therefore you can construe that to be some indirect financial interest. You can see I've gotten funding and have been scientific advisor to a number of companies even who are trying to do the right thing in the space. So that's a disclosure that I need to make at the outset. But without further ado, let me get into what is an endocrine disruptor. So Rachel Carson, in her book about DDT, probably put this issue really on the global knowledge map. And at that time, Dr. Carson was writing chiefly about the effects of that pesticide on wildlife. Not long thereafter, we had an unfortunate episode that I talk about, I think it's in the next slide, about a pharmaceutical called diethylstilbestrol, a pharmaceutical that was given to pregnant women with good intention for purposes of prolonging pregnancy, reducing symptomatology. And as we'll talk about, there were untoward symptoms. Now, those two chemicals are no longer used on a widespread basis. So you could consider that a victory at some level. But when we're talking about chemicals that scramble our natural molecular signals and thereby contribute to disease and disability, we're not simply talking about very high levels of exposure or so-called mistake chemicals. We have emerging evidence to suggest two themes that are troubling. One is that little things matter, that extremely low levels of exposure to these toxic chemicals can have significant and even lifelong consequences. And that the chemical exposures that I'll talk about in this basic definition are many and sundry, unfortunately. So at the core of what I'll talk about tonight are chemicals that disrupt our natural molecular signals. That doesn't have to be by disrupting the receptor where a hormone binds directly. It can be done through changes in expression of genes in a host of ways. But ultimately, there has to be some change in hormonal function. And that change in hormonal function thereby contributes to disease and disability. So those are the two steps of the two legs on the stool, if you will. We now know of at least 1,000 endocrine disrupting chemicals. The reality is getting at the tip of a proverbial iceberg when it comes to the number of chemicals that are endocrine disruptors. This slide provides a sense of how broad and widespread these chemical exposures are. These are really part of every person's daily life at some level. If you think about the products that we're listing out here. The first report that put this issue on the scientific map was the Endocrine Society Scientific Statement in 2009. The Endocrine Society is not some left-wing extreme organization. It's an association of 17,000 endocrinologists from 100 plus countries across the world, really trying to do the right thing and put the science out there. And at the time, they had identified laboratory evidence that built on the findings of the health effects of diethylstilbestrol and DDT, and identified grave concern about a broader array of chemicals and their effects on laboratory animals and tissues. Just 3 years later, the World Health Organization, United Nations Environment Program, put this issue on the radar as a global public health threat of great magnitude, speaking to how rapidly the evidence has evolved, even since the 2009 Endocrine Society first scientific statement. We did a series of studies not long thereafter in 2015, identifying conditions where the evidence is strong for these hormone disrupting chemicals to contribute to disease and disability. We focused only on those conditions for which the evidence was strongest. We limited ourselves to measuring out the disease burden that was specifically traceable to these chemical exposures. We used rigorous criteria for evaluating the human and laboratory evidence for the effects using validated criteria for evaluating each set of and thread of evidence, and we used the Intergovernmental Panel on Climate Change's approach to integrate those two threads of knowledge and identify what you might call a probability of causation. We get focused all too often on causality as a stringent criteria, but if you go back to the lecture from the late Sir Austin Bradford Hill, who really defined the criteria for causality, he himself, in the landmark lecture he gave in the 1960s, by the way, that was during the tobacco wars, and it was really spurred by the debate about regulating tobacco. He said that the stakes really matter when you decide what level of evidence you're going to accept before you act to limit a toxic exposure. So he made the analogy of in the workplace and stated that on fair evidence, one might act. We've misinterpreted over the years, especially in the medical world, I have to say, I don't mean to be a critic of my own domain, but we assume that causality is either yes or no, but the reality is that there are shades of gray of evidence, and you have varying degrees and strengths in studies. And the reality is, from many of the exposures I'll talk about, they're not randomized controlled trials that can be conducted ethically. And so we often have to rely on observational studies and really look at the rigor and the control for other factors that might explain the observed effects. So all of these caveats weighted down the estimates I'm about to present that Anne referred to at the top of the presentation. And yet what we found in Europe first was the cost of endocrine disrupting chemicals were on the order of 160 billion euro, roughly 209 billion US dollars, to give a sense of comparison, a year. And again, that's an annual cost insofar as exposures continue at current levels. And that estimate was driven largely by the effects of pesticides on the developing brains of young children. And the analogy there is, you might say, well, how is that so dramatic? Well, okay, a child comes back from school, let's say, with one less IQ point. Maybe mom might not notice, the teacher might not notice, doctor might not even notice. But if 100,000 children come back with one IQ point lost, the entire economy notices. Study that each IQ point is roughly worth 2% of a child's lifetime. If a child makes on over $1 million over his lifetime, the economic benefits of saving that child's IQ point, or the cost of losing that IQ point, are roughly $20,000 per child. Multiply that across 4 million children born in the US each year, and you get a whole lot of zeros on the right side of the equation. But I do want to make one other point about this slide. This 163 billion euro, the 163 is based on one other paper that was added after this infographic was put together, was based on less than 5% of known endocrine disruptors, a subset of diseases due to the few endocrine disruptors we studied, and a subset of costs due to the few diseases due to the few chemicals we studied. So this estimate, and it was 1.2% of Europe's GDP, is an underestimate of an underestimate of an underestimate, yet we get large costs to society, suggesting an opportunity in the form of prevention. Now, soon thereafter, as Dan alluded to, we did the same exercise in the US, and the story is a little different here. The costs are bigger, which is the bad news. I don't mean to add another negative story about our country these days, but $340 billion is 2.3% of our gross domestic product. But there's some good news. The cost of pesticides is much lower, $42 billion. You might ask, well, why is that? That's because in the United States, we had a 1993 Federal Food Quality Protection Act that unanimously passed through Congress that required a safety threshold be added to protect children from pesticides in foods. And that led to substantial limits on the exposures of children, in particular, to pesticides that harm the developing brain. By disrupting thyroid hormone in utero. Babies rely on mom's thyroid hormone in the first trimester, and thyroid hormone is a terrific growth factor for brain development. Now, you might say, hooray, but the cost is still higher, so why? And the why there is that flame retardants cost even more out of that endocrine disruptor related disease burden than in Europe. And that's because we've required flame retardants to be added into every piece of furniture in the United States between 1973 or so and 2015 was due to actually California instituting a law that was intended to stop the spread of fires. But unfortunately, those flame retardants didn't actually slow the spread of fires one bit, didn't save a single life, but it ended up contaminating an entire generation of children, such that still to this day, on average, each child in the United States loses a few IQ points, costing the economy $240 billion in lost economic productivity. So that's why the United States has such a high cost, whereas in Europe, the cost of flame retardants, because they were banned much earlier, is on the order of $9 billion a year. So the theme here with these slides is that policy predicts exposure, exposure contributes to disease, and disease costs us all as a society and as an economy. And that's a theme that we'll talk about through the remainder of the presentation. So I mentioned that we were talking about endocrine disruptors in the context of a 2009-2012 report. We did another report in 2015. It's 2021 after all. So you might wonder, well, what's happened since then? The fact is that the field of endocrine disrupting chemicals has exploded. There was a second Endocrine Society scientific statement in 2015 with 1,331 scientific references. The American Academy of Pediatrics, my home organization, along with the Endocrine Society, published a wonderful document. I admit I'm biased because I'm one of the authors of the document, a technical report and policy statement documenting chemicals intentionally and unintentionally added to foods and their effects on the developing endocrine system and other organs in children in 2018. Those reports I talked about did not mention, apologies for the typo, a large group of chemicals, 9,000 or so, called fluoroalkyl substances, or PFAS. You've already heard from Linda Birnbaum, so I don't have to go into all the details about the PFAS, but suffice it to say, there are substantial studies now that document effects on growth retardation in children, among other consequences that we'll talk about in a few minutes. And that series of studies we did in 2015 did not have the opportunity to focus on breast and prostate cancer the way we could have perhaps back then. The evidence just wasn't as far along at the time, admittedly. And even since we published those reports in 2015, birth outcomes weren't prioritized in the way that maybe they should have, or we should have thought of at the time. So that brings us closer to the present day. So one of the first steps we had the privilege of taking in 2020 was to publish a scoping review in the Lancet Diabetes and Endocrinology that you could say builds on the reports I just talked about. And our goal here in this scoping review was not to be completely systematic. That would be, with this size of a field, almost impossible. Maybe not impossible, but very ambitious. So you can see on the right, we had our search criteria, and our emphasis in this review was to update the literature and focus more on chemicals that were coming into use or still being used, as opposed to what we might call the legacy chemicals. So chemicals that are already banned or in the process of being phased out, we didn't focus on in this report because we wanted to be relevant for thinking about policy and proactive action. So I had the privilege of working with a great team. So this is a bit of the opposite order of doing this kind of slide, but I think it also tells you how I feel about these wonderful people who supported me. My postdoctoral fellow, now junior faculty, Linda Gross-Kahn, was the lead author. A colleague in France, Claire Phil, also from France, and Children's Study, were my co-pilots in this effort. So this slide presents some of the earliest findings from the first category of outcomes that were the focus of our report, and that is birth outcomes. So we, in this report, identified a particularly rapid acceleration in evidence to support the notion that PFAS slow fetal growth, such that they increase the likelihood of low birth weight. There are a few studies that are not as consistent as the others, but suffice to say, the majority preponderance, we're talking about dozens of studies at this point, show, particularly with late exposure, a strong association in relationship to decreases in birth weight. And most of the birth weight gain really occurs in later pregnancy, so that actually adds to the biological plausibility and doesn't counteract it. In addition, phthalates, plasticizers used in personal care products, cosmetics, and food packaging, have been associated not only with reductions in gestational age. We know preterm birth is a major concern, it's a major focus on March of Dimes, for example. But phthalate exposure in utero also shortens anogenital distance. And anogenital distance is a marker of male versus female sex hormone balance in utero, which shortened AGD being associated with male factor infertility, as well as other consequences for boys becoming men in particular. And so the fact that not all these studies show as consistent an association as you might expect should make you take a pause and think about the various studies and the strengths and weaknesses of them. But when you have the overall literature put together showing a tendency for this effect, you have substantial probability of causation in particular, especially when you look at the rigor of the studies that show the increases or the reductions rather in anogenital distance. In our previous report in 2015, we had published substantially on the effects of normally flame retardants that I talked about in organophosphate pesticides, in particular chlorpyrifos, and their effects on the developing brains of young children. It's fair to say not much had changed other than additional evidence supported those associations at the time in 2015. What's a bit new is a bit additional evidence to support clinically significant attention deficit disorder, behavior problems, and autism spectrum disorder. We now say the associations are as rock solid as those for IQ decrements. Keep in mind that the statistical power you need for effects on ADHD and autism are much more substantial than they are for IQ, meaning that it's harder to detect those kinds of effects that are clinically significant in the first place. Clearly, there's more work to be done, but even back in 2015, we had identified a substantial range for probability of causation for these more clinically significant effects. Where I would say the field has advanced most substantially, and this is why the size of the font in this graphic is relatively small, is in the realm of obesity, diabetes, and related conditions. So we now know about 50 chemical obesogens, chemicals that literally make us fatter. Nothing that I'm going to say in this presentation diminishes the import of diet and physical activity as the drivers of the obesity and diabetes, twin pandemics. But we know that synthetic chemicals can scramble those basic molecular signals and thereby contribute to disease and disability. So we've talked a little bit already about phthalates and their effects on male factor reproductive development, but phthalates disrupt the expression of proteins that are crucial for lipid and carbohydrate metabolism. PFAS literally have been associated with slowing the resting metabolic rate, contributing to increased weight gain in adults who had successfully reduced their weight through healthy diet and good physical activity. So literally, you have chemicals contributing to obesity and diabetes independent of factors that are extremely well known to contribute to weight gain. And in particular, what's already emerging is evidence to support some of the chemical replacements having effects on obesity and diabetes. So take, for example, gestational diabetes, which we've also associated with PFAS. One study from China identified what's called a short chain PFAS. The short chain PFAS, as Dr. Birnbaum probably explained in her presentation, are increasingly replacing the legacy long chain PFAS. And though these PFAS that are short chain have a short half-life in the body, one Chinese study associated these short chain PFAS with gestational diabetes, suggesting potentially a version of chemical whack-a-mole. A more salient and even recent example are the 40 or so artists formerly known as BPA, like BPS in particular. And at the bottom of the slide, you see BPS listed as a possible contributor to adult diabetes. And that's based on a French longitudinal cohort that found BPS to be associated with increases in incident diabetes, which is remarkable because that study came very soon after the introduction of BPS into population level exposures. So we're talking about very rapid research identifying already, almost ahead of, in some cases, animal studies, this notion of whack-a-mole, where you replace one stance from a policy perspective of having one problem replaced by another. The evidence for effects of synthetic chemicals on male was already strong. In particular, where the field has really advanced to raise even further cause of alarm is reductions in semen quality. And that's among the best characterized effects historically in the field. There's this whole notion of the testicular dysgenesis syndrome, where decreases in sperm count, male reproductive defects like cryptorchidism and hypospadias, not to mention testicular cancer, go hand in hand and arise out of a dysfunction of the male reproductive development axis due to typically disruptions in testosterone production, but also hormonally sensitive proteins like INSL3 in the human body, thereby contributing to this cluster of conditions in which some men will show one or more of the effects depending upon the timing or the genetic predisposition. I'm not going to say here that the evidence is completely solid and consistent across all the studies, all showing the same directionality. What I think is new about this slide that's also concerning is the research suggesting that to geographically diverse parts of the world, suggesting independent findings from different populations, which speaks to the repetitive and rigorous nature of the potential association. Anne, do you have your hand raised? Am I having bandwidth issues?
I just want to say, Leo, sometimes you're cutting out, and I don't know if there's anything you can do to change that for us. You're kind of freezing at times.
What I can do is turn off my video. Why don't I do that?
Okay.
I hope that's better. Sorry about that. I'll just soldier on. So moving on to other effects that have been identified, in particular, where we've seen substantial advances in our understanding of endocrine disrupting chemicals are the effects on female reproductive health. In particular, we've identified multiple studies now that have suggested bisphenol A and PFAS increasing the risk of polycystic ovarian syndrome. In addition, two studies we'd already identified suggesting phthalates as contributors to endometriosis. Other studies have now suggested that PFAS are associated not only with endometriosis, but also breast cancer, perhaps through different mechanisms, but still raising serious concerns about the breadth of impact that arises as a result of what we increasingly call the ovarian dysgenesis syndrome, which is in some ways a sibling of the testicular dysgenesis syndrome. So clearly, what I've described here is a rapid overview of a scoping report. Sorry, just wasn't sure if I was having bandwidth issues or if there was a question. I'll just keep going for now. We'll do the questions at the end, I appreciate. So we clearly need to do systematic reviews and properly vet these associations. Just looking at single studies and observing them is important, but it's only a step in the right direction. We need to understand the probability of causation more rigorously and quantify the disease burden and cost estimation. But when you look at this rapidly growing state of evidence, you have to ask yourself at some level, isn't this enough evidence to act, which is arguably what Sir Austin Bradford Hill would have said. Now, and the fact is that there is enough evidence to act. In particular, there's evidence that families can take safe and simple steps to limit these exposures. I'm going to skim over these and then focus the rest of the presentation on the policy frameworks and what we know and what is going well and not going well in that space. We know that eating organic can reduce levels of pesticides, not only in high socioeconomic status populations, as well as low resource communities as well. This is a newer study from Mexican-American community in California that showed decreases in organophosphate as well as other pesticides in a population that some might have presumed early on would not be as amenable to reductions in these pesticide exposures due to socioeconomic and other limitations. But organic diet interventions can work in these communities as well. And the same can also be said for bisphenol and phthalate exposures. A canned food consumption intervention and avoidance of processed food reduced it in a high SES population published in 2011. And a bit of a different intervention in 2016 found that tween girls who were using personal care products read the labels more carefully and picked and chose the products they used. And they saw substantial decreases in the levels of phthalates in their urine over a brief 3-day intervention. So rapid response to the observed intervention. The household environment is also important too. I know this slide has a lot of text, but essentially what was done in this study, led by a group at Harvard with some of my own colleagues at NYU, was to take 3 households and workspaces that had undergone a series of interventions and evaluate changes in PFAS, brominated flame retardants, and the replacements for PFAS. Again, another for replacements for PBDs, rather, organophosphorus esters, another chemical whack-a-mole situation. And evaluate the changes in dust levels in relationship to different degrees of intervention, a full or partial healthier materials intervention. And they found a graded response, particularly for the PFAS, but also for the organophosphorus esters and the brominated flame retardants, based upon the degree to which they did this healthy materials intervention, speaking to the potential impact. Now, that's not direct human impact, but that's by reasoning a major pathway to human exposure to these chemicals. So the remainder of my presentation, and I want to give time for questions and comments, is going to be on the policy framework that we can use to limit these exposures to dietary contaminants and other sources of exposure. Now, what I'm going to talk about is mostly the purview of a review of the policy frameworks on endocrine disruptors led by Chris Kathodis at Wayne State, Laura Vandenberg at UMass, and colleagues in France and Spain, Barbara Demonex and Remy Soma from France, and Mikel Porta from the Institute for Medical Research in Barcelona. And our main findings in this report, when you look at the global perspective, really shine a light on the strength of the European approach. And the main difference between Europe and the United States when it comes to EDCs is this distinction between interpreting hazard as a way to act on policy as opposed to risk. So the difference between hazard and risk is that risk accounts for exposure and the degree of effect, whereas hazard is a regulatory framework in which if there's any level that causes an adverse effect, one acts and proactively intervenes to prevent. Now, that's really important with EDCs because you can't extrapolate from high dose exposures to low dose reality. And that's because there are non-monotonic or U-shaped functions which follow endocrine biology or endocrinology. And then there are non-linear or steeper than linear dose response functions. So simply drawing a straight line isn't going to give you the right answer when you're trying to think of what the safe level of a chemical exposure is. Now, Europe is not perfect in this regulatory framework. There are still less than ideal limitations for medical devices, even with pesticides, as I talked about earlier in the presentation, they're catching up. Whereas in the US, there are some strengths. We talked about the Food Quality Protection Act, but even with the Food Quality Protection Act that required a screening program for endocrine disrupting chemicals in pesticides, still very few pesticides have actually been screened by the EPA as a result of this project, as a result of that piece of legislation that I heralded as landmark. In addition, when you look at cosmetics, the FDA's Federal Food, Drug, and Cosmetic Act has a gaping loophole, what's called the fragrance loophole, that allows a fragrance to be used without reference to specific chemicals used in that fragrance to protect so-called trade secrets. And then we have some strengths through the revised Toxic Substances Control Act, but endocrine disrupting chemicals are not even specified in that new US legislation signed at the end of the Obama administration. And here are a couple of case studies that really draw into stark relief these differences between the US and Europe when it comes to endocrine disrupting chemicals. So chlorpyrifos is unfortunately a major example where we've had a bumpy history when it comes to science and policy. There was a withdrawal of its use in indoor environments in 2000, and despite the Food Quality Protection Act requiring limits on the use of this pesticide, there's been a protracted process that only has really ended with a series of court challenges and a major manufacturer announcing its intention to cease agricultural use of this pesticide that's toxic to developing brains. It's an organophosphorus pesticide. Whereas in Europe, there's essentially been a process through the European Food Safety Administration that identified that no safe level could be set for chlorpyrifos. Therefore, the approval criteria for chlorpyrifos in the first place could not even be met. So renewal wasn't even allowed for that pesticide. And essentially, it's functionally banned as a result of the understanding of the neurodevelopmental effects that are identified in human studies at the lowest levels of exposure. By the way, mostly American studies. When you look at bisphenol A or BPA, which is used in the can linings and thermal paper receipts, as well as polycarbonate plastics, the US has invested a substantial amount of resources to try to get the best science to inform policy on a chemical like BPA. But this national clarity study that it implemented nearly a decade ago still had substantial difficulties in harmonizing its results between the Food Drug Administration, which has had its approach questioned for many years, and academic labs that don't follow what are called good laboratory practices. Now, that sounds like the academic labs are not doing their job, but good laboratory practices is actually an industry label for a series of steps that really is more about microbiological and other aspects that don't really inform toxicology testing. And still, after a substantial amount of federal investment, there is ongoing debate about the safety of BPA, almost not resolving what was intended to be resolved by a substantial national initiative. In Europe, we've had a much more straightforward process where essentially there was evidence identified suggesting that it's a hazard to the mammary gland in particular and affects cognitive and other metabolism. The French government has really pushed the EU to make it a substance of very high concern. And ultimately, most uses of BPA have faded out in Europe. There's a bit of a loophole in that some uses of BPA are still allowed as a monomer intermediate, but we've already seen substantial manufacturer actions to limit BPA in Europe. So there are also a variety of other approaches globally. I just want to highlight on this slide the fact that the Stockholm Convention now has significant bans on PFAS. Of course, the US is not a signatory to these agreements, but that gives us a lot of hope for global action that can also make it difficult for manufacturers to continue to use a chemical in one particular country that allows it, like the United States. So what do we need to get us out of this rut at some level? And the end of the report really focuses on that above all. We need better approaches to testing and identifying exposures, evaluating their exposures, limiting them through regulations. And at the end of our review, we talk about a need for an international agency for research on EDCs, much like the International Agency for Research on Cancer. Clearly, we've got a big problem in that we're behind when it comes to testing and identifying EDCs. And that's not anyone's particular fault, any lawmaker's particular fault. We've just caught up substantially in our understandings of endocrine disrupting chemicals. I mean, the first scientific report to really put it on the map was in 2009, the Endocrine Society statement. But that doesn't mean we can't work to catch up. And one of the areas where we have still some substantial gaps is that we assume the endocrine system is estrogen, female hormone, testosterone, male hormone, thyroid, and maybe a few other things. The endocrine system is much more complicated than that. And so we need in particular to develop better assays to cover a broader array of receptors in the human body that can be affected. One approach that's been floated is this notion that you accelerate the system by using what are called in vitro screening methods, which are little plates in a laboratory where you can squirt small amounts of these chemicals and see if you can identify early effects, and then use animals and other tissues to really assess the effects in real life or in vivo, which is going to make some people happy because there are concerns about animal rights consequences of large scale animal testing of these chemicals. But suffice it to say that the problem with this approach is that we still have substantial flaws in the framework for these high throughput screening methods. We still have some chemicals not being sensitive or specific enough in their detection of these effects in the first place. We made some progress, but we also need a broad international basis for measuring these chemicals in the first place. I mentioned that I've done some work in low middle income countries, and in particular, most of that work has been really focused on metals, but the reality is one of the reasons we haven't been able to do a lot of work on endocrine disrupting chemicals in other countries, we don't know what the exposures are. They're likely to be similar, if not more extreme, because increasingly these chemicals are used in context with much more limited regulatory context. And that kind of data can drive safe and simple steps in educational campaigns to limit exposures. It's also important to remind everyone that there's this notion of right to know. People should know what they're putting in their bodies as well. So there's a human rights aspect to this that's terribly important. I've already hinted to this dichotomy between the US and elsewhere when it comes to hazard versus risk. And I won't harp on it too much, but there are multiple flaws to the assumption that everything can be evaluated from a risk paradigm. Often you don't have the data. Often you have endocrine disrupting chemicals just fundamentally being a square peg in a round hole when it comes to these chemicals. And we assume at some level that everyone is a 45-year-old adult when, I have two tween boys at home here tonight, one of whom may have been disrupting the Zoom earlier on through internet use. And that 12-year-old is not the same as, let's say, me, in terms of how they would deal from a sensitivity perspective with respect to a chemical. So there's really a very strong scientific argument to leap to a hazard-based paradigm that doesn't consider the exposure, that considers a chemical to be problematic if it causes an effect at any level of identified exposure. And there are precedents for this. In Europe, we have it for carcinogens. We actually have it for EDCs now. We have it for persistent bioaccumulative and toxic chemicals. And there are lots of oversimplifications of risk versus hazard that are being used, often by industry-funded sources, to counter message and undermine this notion. But this is the strongest science and the way we should be regulating for policy to limit these exposures. So this slide just depicts some steps that need to be put hand in hand so that we have a really strong hazard-based diagram. We need a good testing program to evaluate chemicals on a real-time basis because new chemicals are going to be produced, not suggesting we undermine industrial activity through this process. We just need safety to go along with it. And we need clear timelines and action following the identification of EDCs. So finally, at the end of this article, and this is something I feel very strongly about, we've had an international agency for research on cancer for about 50 years. Of endocrine disruption came on this. So we found policy recommendations, tentative politics that could really weigh science from laboratory, animal, and human studies, form the global. And so we're in a similar place with endocrine disrupting chemicals right now. And so this article called for a series of steps to implement that or even broaden the scope of the International Agency for Research on Cancer. So with that, this framework would align very much with other intergovernmental processes when it comes to chemical safety. There are key characteristics of endocrine disrupting chemicals that are already known that can be built on to do this. And it would foster global collaboration, which is desperately needed. So with that, we've seen a doubling of exposure outcome relationships due to endocrine disrupting chemicals. In particular, a unique explosion of evidence for PFAS, as well as new effects of endocrine disrupting chemicals and a strengthening of evidence from many of the previously identified relationships. And we need policy action that comes with identifying EDCs, better methods to evaluate them, global biomonitoring programs, inclusion of economic costs associated with these morbidities, so we really rebalance the decision-making process and don't overproduce when it hurts society. And establishing a hazard-based approach informed by science through an international agency for research on EDC. So I apologize for the bandwidth issues, and I hope I can be useful even more so in the form of questions and answers. Thanks again.
Thank you so much for your presentation. We greatly appreciate it. Leo, if you want to stop sharing your video or your screen, you can do that. It might give you some more bandwidth there. And maybe we'll try to do your video for this question and answer so people can see you. I'm going to start off with the first question here is, what do you know of the current EPA and plans to address EDCs? Given the political shifts, can we rely on the EPA to be consistent leader on EDC regulation?
So thanks for the question. So I have hope. There's a lot that EPA has to fix Let's start there. Second, climate change is always in my mind going to be the #1 global public health threat of our time and our generation. But the analogy I make is that you cool the planet and you don't deal with toxic chemicals, you'll have a population that's less well able to live in a global environment for generations to come. So I expect actually strong action on PFAS. I think there's momentum in that direction, and that would be a huge step. It can't hurt that there have been so-called red state senators that have actually fought really hard on this issue in North Carolina that have been affected by Cape Fear and other contamination episodes. So I'm hopeful that we can build off of PFAS and then embrace a broader debate and discussion on stronger policy frameworks. And I think there's just a lot that will get fixed if you actually staff the EPA.
Thank you. I'll take a next question and maybe Anne will go after me. But the next one is regarding fluoride. Have you looked at the emerging evidence finding fluoride added to drinking water as being harmful? Is fluoride an endocrine disruptor? And that's kind of merging a few questions actually into one.
So it's a great question. This is a fiery and testy debate. It's not lost on me that fluoride is the basis of a JAMA Pediatrics article that had not only a major publication come out finding effects of fluoride exposure on children's learning and development, but it was accompanied by an editorial that almost softened the findings at the moment of publication. There are some deeply pitched camps here. I think we have to have some perspective about the fact that we didn't know the effects of fluoride on developing thyroid when we started using it as an additive. We've also advanced our technology in delivering fluoride more directly to teeth as opposed to using large-scale addition to water. Now, let me take a step back and just say a few things about the evidence. Most of the studies that have shown the effects of fluoride in developing brains of kids are from very high levels of exposure. The Canadian study that was just published, I think about a year ago and change, was the first really almost American style exposure. And even then, a lot of people will say it's highly variable. It's a study that needs to be done in a United States context. I think it's that simple. Does that mean we need to recalibrate our thinking about the trade-off when it comes to adding fluoride indiscriminately to water as opposed to delivering it in the form of pastes or other materials? After all, my kids brush with fluoride because that's the way you develop teeth. Fluoride needs to go for, that's what it's there for. It's to strengthen that enamel in the long term. So, you know, the answer there, I think, is that we need to think about it again and take a step back. We get used to things in public health. Public health need not compete against public health. Now, I'm not saying it's zero. I'm not saying the evidence is definitive enough to give a clear readout on what specifically we have to do. I know the Institute of Medicine is heavily engaged in this process as well. And we have ECHO, as Anne said at the top, that could really be a good resource for informing this kind of important question.
I'm going to ask another question a little different. Thinking about solutions, any thoughts on funding a global biomonitoring program? And how do you identify emerging contaminants to include in this global biomonitoring program?
The great question, Anne. So the challenge is always resources, right? You need, when you think about why the US is a leader in global biomonitoring programs, it's because they send a van around, the National Health and Nutrition Examination Survey vans. They go all over the country. They pick 20 counties every 2 years. They go to those counties, a little more limited with COVID, but they draw a bunch of blood. They have trained nurses, phlebotomists. You have freezers set up to rapidly process the samples, to rapidly store the samples after they get centrifuged and all that stuff. There's a lot that if you were to do that in certain parts of Asia, certain parts of Africa, would be a lot more problematic to pull off, right? So there's a resource problem that needs to be resolved to address this. It's also not lost on me. Europe just started doing its biomonitoring program a couple of years ago, frankly, in a systematic way. Now, could the United States and Europe show a great example of international collaboration by building out, maybe not in every country in Africa and Asia, I'm just picking on those as an example, but maybe a select number of countries, a select number of populations, a little urban, a little rural, and really get that kind of data that's terribly important? Yes. Would you have to measure everything and everyone? No. You'd want to measure POPs, persistent organic pollutants, some of the legacy contaminants. You would want to measure metals because those are significant issues. There's a lot of people out there screaming and hemming and hawing about lead and whether it's from paint or if it's from artisanal mining. I personally have a very strong and abiding perspective that we've seen global decreases in lead levels because we got lead out of paint country by country, just like we did in gas. There's some people out there that disagree. That could actually be an opportunity to build the infrastructure to really evaluate this kind of question. Do you need to measure phthalates? Do you need to measure bisphenols? Yes, they're there. There's no debate about it. Look at the plastic and the waste sites, for example, not to mention the products that are being delivered. I mean, in the COVID pandemic era, we've seen a lot of people being delivered plastic water bottles as a healthier form of water. And, I have some strong opinions about that and the overuse, and I think you can tell what they might be, but I'm not going to suggest here that you do things that put you in harm's way when it comes to a virus that kills. So I think you have to adopt the mindset of this being an infrastructure more than a specific testing program. You can actually put in the testing. The testing can be done anywhere in the world, frankly. It's really about, it's above all being able to find the freezers and being able to power them on a consistent basis as well. I mean, there are a lot of considerations, but through some good creativity and some global collaboration and cooperation, I could see us getting there in the next decade.
So we've got a little bit longer one here. So you discussed how we can improve overall health for minority and poor areas. However, how can we work towards policies that enable for these communities to have access to fresh fruits and vegetables that are not laden with pesticides? For example, these individuals may not have room to grow their own food or have the access to farmers market. So what policies can we do to help them in this situation?
I'm so glad. I appreciate I have red hair and light skin, but I'm the son of Hispanic immigrants, poor farmers. So this really resonates with me as a question. And I published on documenting the disparities in endocrine disrupting chemical disease burden that are borne by Latino and African American populations. That's real. And that's because you have products that are sold to communities who are less well able to choose, in some cases, what they buy, and maybe marketed directly in a way that may be predatory, that may be increasing their exposure. So let's just start there. I have seen at the same time a lot of hope in the space, and that is in the form of the broader growth of organic and healthier choices when it comes to less chemical contamination. So let's focus on organic. We've seen double-digit percentage per year gains in organic food as a portion of market share. So what that means is you've seen price margins start to come closer to equal. They're not quite equal, but you see the big box stores, and let's face it, a lot of low-income families go to these big box stores, get what they need and go, and they the price margins are such that they're putting the organic food side by side with the conventional. And, you know, that's where thinking about the dirty dozen as opposed to the clean 15 is really important. Those leafy greens and vegetables are the ones where I want families. I do this at Bellevue Hospital where I work. That's where I'm a general pediatrician still to this day. Those are the ones where you eat the outer layer, therefore have the higher contamination directly of pesticides. And so you have a higher level of exposure as a result of that consumption. Those are the ones you care about. An avocado, maybe not so worried about it. I will tend to buy avocados organic as a statement, as the support for organic agriculture, but that's a personal decision. And that's a distinction that I make. Now, are there food deserts? Yes. Are organic options and unpackaged food options broadly available in a way that I would like? No. We have a long way to go. But we've come so far, such that a decade ago, I didn't bring this up as a general pediatrician in practice in low-income communities that I serve.
Thanks. Can we do one more question or a couple more? Here's a
Do
question about,
probably
Okay. I'm here as long as you want.
okay, about polycyclic aromatic hydrocarbons. Today, a Wisconsin legislative committee listened to testimony about polycyclic aromatic hydrocarbons found in coal tar pavement sealants. An industry expert testified that the research done by USGS scientists was flawed and dismissed their findings about risk of cancer from PAHs. Can you speak to the risk of PAHs and or the reliability of research by the USGS?
Well, so first of all, the person and the funding that does the research matters. That's arguably one of the biggest reasons why federal investment in research is so strong and so enthusiastically supported on both whatever stripe you are politically. So when I look at a USGS study as opposed to an industry study, and I can't say I've read either study, I think you can already see a divergence of perspective and potential conflicts of interest that matter a lot. I think it's also telling when people don't disclose their conflicts. I mean, in my case, my second slide has all these things, and you can judge what you judge. And if you think I'm selling something, that's your personal prerogative to weigh in that decision. I think transparency is crucial. So what do we know about pHs? We didn't talk a lot about pHs, but pHs are a big part of why particulate matter causes disease and disability. Air pollution. Big part of air pollution, when you think of vehicles, that's the carbon-based form. It's a little different in New York where we burn a lot of heavy metal oil, heating oil in homes. So it's a different form of pollution. We have vehicles, but we've gotten rid of a lot of most of our taxis, for example, are electric. So different, in California, for example, a lot of air pollution exposure is pH heavy. And roadway erosion and ultimately emission isn't a source of that. Is it the same source as fossil fuel burning? Probably not. But when you look at pHs, they're carcinogens. They're hormone disruptors. Some are estrogenic, some are anti-androgenic. They have effects. Air pollution is an obesogen, for example. So air pollution is an endocrine disruptor. I can't tell you what an air pollution is an endocrine disruptor. If I had my hunch, it's actually the pH, for example. So I can't drill down into the USGS study particulars and the particular source of pH exposure, but it's fair to say that if it's harmful in a cigarette, which is a major source of pHs when you burn things, that it's probably not a good thing to have in something that can volatilize, that is to become a gas and ultimately be inhaled through contact with, let's say, a roadway. I probably should stop there.
Thanks.
We'll do one question from me and then one more question from Anne. So this one is in reply to what you mentioned earlier about climate and toxics reduction connection. So this person's saying how, there's been the major expansion of plastic production, and through that using increased supplies of fossil fuels. And there's also, other impacts, and how you mentioned the impacts of crashing sperms counts, etc. So he's asking, do we need more aggressive action against these industries, more than better research or biomonitoring? Like, what else do we need to do? Should there be more aggressive action or another task?
Look, I'm always going to tell you that further research is needed. That's not because I get funding for research. Okay, you can argue I have a bias in that respect because I get funding for research. And I'll be honest about that. But there are a lot of things we don't know. When you go back to what I talked about at Sir Austin Bradford Hill and about this notion of probable cause, which is a lot like preponderance of evidence in a court of law, right? It's not even like that because the stakes change how you weigh and decide. It's fair to say that we have preponderance of evidence for a lot of associations of endocrine disrupting chemicals with serious conditions that affect people's lives. I'm not one to tell you where the line is from a policymaker perspective. I certainly will lay the evidence out. I'll certainly give my professional insight and opinion. I would argue you've got enough to make a business case for at least 5 categories of synthetic chemicals of great concern. I'm talking about the flame retardants in electronics and furniture, pesticides in agriculture, bisphenols in aluminum cans and thermal paper receipts, phthalates in personal care products, cosmetics, and food packaging. And you've got the PFAS, so water contaminant, nonstick cooking, oil and water resistant clothing. If we can really focus on those 5 groups of chemicals and really get safer alternatives used, that would go a long way. And, if we could actually get unity as an environmental NGO and otherwise health communities around that too, that would go a long way, because I think to some extent we feel like we're competing for attention. And to some extent, you could say it's climate versus chemicals. I don't see it as you saw at the top. Climate to me is not so distinct from chemicals. I think there are distinct issues. You have to get rid of contamination as well as climate, but there are co-benefits. So, one of the pleas I'm making here is for harmonized action. But is there enough cause for action? Yes.
Great. So last question, we've had another question about fluoride, and just to ask the question, I think for fluoride and maybe for other heavy metals, are those endocrine disruptors? Are they considered endocrine disruptors? Fluoride and... So
fluoride technically to me is not a metal. First of all, fluoride is on a halogen on that right side of the chart, but that's me being a nerd. Leaving that aside, metals could probably have effects on the developing brains of people by messing with hormones. There's a lot we don't know about the specific mechanisms. Going back to Anne, what we first worked on, mercury contamination. So methylmercury, do I know every specific mechanism by which methylmercury damages the brains of children? I still don't. Are there endocrine mechanisms probably beneath it? Probably. Are the only mechanisms? I don't know. I think there are more than endocrine mechanisms behind it. Does it matter from an action perspective what mechanisms are really involved? Only insofar as it adds to the evidence. I mean, if you know it's a problem and you have evidence that there's a problem, all a mechanism does is strengthens the evidence that there's a problem. So you need to act. I'm not trying to sound blasé about it, but I just think we have to frame. I do think we can get a little focused on endocrine mechanisms being the only mechanisms of disease and disability, but they're certainly not. We already talked at the top about immune disruptors. We've talked about direct damage to organs too. They're all in play. I do think the endocrine system is a nice framework for seeing the breadth and depth of impact. When you mess with hormones, you mess with your entire body. Thyroid is brain, thyroid is temperature, thyroid is heart, thyroid is muscle. That's just one example. Estrogen, everything. Even for guys, for both sexes. Just different things for different sexes. And the same would be true for testosterone.
Mm-hmm. Thanks.
All right. Well, we are going to wrap up tonight. This has been wonderful. Thank you so much for attending here, Leonardo. We definitely appreciate it. There's been some thank yous in the Q&A that I just want to say that some people have been saying thank you for your information. And thank you for your time tonight. We really appreciate that because we recognize that you're a busy individual. So we're lucky to have you and to join us again. Is there any last words that you wanted to share?
Sure. First of all, I'm delighted. I hope I can see you guys in person soon. That would be great. I have a lot of hope. And that's just not just me, putting sunshine and dust out there. It's driven by example. So not long after Ann and I met, I was on the Today Show, and I think it was 2006, and moms were getting all upset about BPA and baby bottles and sippy cups. We didn't have much scientific evidence back then, but the industry ran to its manufacturers, changed its practices for production, and all of a sudden, the FDA banned BPA in baby bottles and sippy cups. Didn't ban it in cans, which we have a big gripe with. But again, there's a lot of power in the wallet or pocketbook, whatever you want to say. We have consumer power, and that can drive the change we seek. And more recent example, a study of 5 buffet-style food packages got PFAS out of those packages in 2 major supermarket chains. Just a study of 5. So it doesn't always take a mountain of evidence to act. It just takes the right voices. And I think we don't appreciate how much consumer activism can do.
Thank you so much. Love ending with a bit of hope and what we can do at home to end out this series. So thank you again. Just to close out tonight for folks watching, again, this was hosted by the Wisconsin Environmental Health Network, which is a group of Physicians for Social Responsibility Wisconsin. We have no more lectures as part of this series, but if you want to learn how to get involved with WEHN, you have a question, you want to know our next event, or you want to look on us on Facebook, we also have lots of resources on our website, different informational topics. And of course, all these recorded lectures will be on there shortly. So that's wehnonline.org. And thank you also to Ann Berman tonight for helping us with the Q&A moderation and introduction. And that'll be it